Hey guys, this is Connor with Doc Waterloo. Today I want to talk about the core training basics that you should apply if you've got low back pain or any kind of low back injury or ongoing chronic issues with your low back. The rules change a little bit when there's chronic low back pain involved. Some of the best exercises that are still fairly basic, like your planks, your side planks, your ball exercises, they might not be an option because you might not be able to handle that amount of pressure around the low back and that stability demand without incurring some pain or some further damage. So among the most important things to do for the low back or for the core when the low back is an issue is first of all to teach the core to function with the low back in a really neutral, safe position. If you can't do that with planks, and a lot of people will mess up planks anyway, so don't put a lot of pressure on that. But if you can't do that with planks, a good way to do it is just lying on your back, getting the core to engage by fixing your pelvic alignment, and then applying some movement to that, some really basic movement. So if I lay down, yes, I'm on the floor. So if I lay down, and assuming I have too much curvature in my low back, maybe I'm arched off the floor, that kind of thing. That's obviously not a good position. Most people will be like that when they lay down, even with their legs bent. It's just usually a sign of the tight hamstrings, tight low back, tight hip flexors, all that stuff. So to do these exercises, the first thing you want to do is touch your low back to the floor. So you can see that takes me from an anterior pelvic tilt, while it's arch in the low back. I can easily fit a hand underneath my low back here. So it takes me from that position to a neutral pelvic position. My core is engaged to get me there, and still I'm not flexed at the low back or in the low back like I might be with a crunch or something like that. So it's still really safe. So touch the low back to the floor. Try just holding that position at first. Hold it for 10 seconds, 30 seconds. If you get tired of doing that, it's a good indication that you probably shouldn't advance it beyond that for now. If this is pretty easy, then what you can do is start applying some really light movement. So I like to do leg lifts from this position, but again, really basic. So keep my low back touching, keep some core tension the whole time, and then just go from my feet sitting flat on the floor to lifting one up, so that my hip is bent at 90 degrees, back down, alternate to the other one, up to 90 and back down, the other foot staying planted on the floor for now. And then just march like this. Again, start with shorter durations, like 30 seconds, work up to a minute, and then like a minute on, a minute off, that kind of thing. For 5 rounds, that's a good sign that you can probably progress. You can also do a hip lift, glute bridge kind of thing from here. So if I touch my low back to the floor like I am already, keep my same foot position, keep my core active, and then I start bridging up from there and just working on maintaining that pelvic position the whole time, so I'm not starting my bridge and arching my back a lot. I'm just keeping the same alignment and lifting as high as I can and back down, and just repeat that same thing for, again, 30 seconds to a minute until it's pretty comfortable for you, and then once it is comfortable, you can talk about progressing a little bit further. But the goal of these exercises, get that low back functioning a little bit, get it to handle a little bit of stress, but really mitigate the big stresses with the other muscles, the obliques, internal and external, the abdominal wall, the glutes, that kind of stuff. Make sure that those exercises are doing the brunt of the work, and then go from there, and then challenge it further.